Welcome to the Holistic Psychiatry Podcast. I'm Courtney Snyder, a physician and holistic adult and child psychiatrist. In this episode, I'll be talking about functional medicine, the risks and benefits, and this is coming from someone who considers myself a functional medicine physician. I use the term holistic because I think it's broader, but part of what that encompasses for me is functional medicine. So again, I'll talk about the benefits, but also the risks. Functional medicine is defined as an integrative, biology-based approach that promotes healing and wellness by focusing on the biochemically unique aspects of each patient and then individually tailored interventions to restore balance. This approach focuses on understanding the fundamental physiologic processes, the environmental inputs, and the genetic predispositions that influence health and disease. In short, the interventions address the roots of the problem. In the case of functional medicine psychiatry, such interventions are aimed at promoting healing and wellness for those with brain symptoms, such as depression, anxiety, mood swings, fatigue, brain fog, hyperactivity, cognitive impairment, social communication deficits, and psychosis. In this episode, I'll first discuss the risks and benefits of mainstream medicine, how people find their way to functional medicine or functional medicine psychiatry, and characteristics of many of those who do. I'll discuss the benefits of functional medicine, risks of functional medicine, and how these risks can be mitigated by functional medicine physicians and those who seek this kind of treatment. So to start with the benefits of mainstream medicine or pediatrics or psychiatry, I'll include that the types of treatments are typically covered by insurance. Mainstream medicine is usually straightforward. Patients share their concern, they answer questions, they're usually examined and given a treatment or treatment options, which is usually a medication, and then they take the medication. Very little may be asked of the patient other than to take the medication or to do a procedure. Symptom relief may be more rapid. This is especially important when someone is in crisis, their symptoms are severely impacting their functioning, or their symptoms are life-threatening or causing irreversible damage. Mainstream medicine is considered the standard of care, so this is a legal term that refers to treatments and practices that are accepted by medical experts as the best treatment for a specific disease and are widely used by healthcare professionals. Treatment interventions have undergone more research. The type of research, however, in mainstream medicine typically is looking at how a group of people with the same diagnosis respond to the same medication. This doesn't account for biochemical diversity. For example, there's more than one biotype of depression and root causes. This is why many studies into psychiatric medication don't yield a high percentage of positive response rates as would be expected for medication. And the disadvantages of mainstream medicine. Those symptoms may improve with the medication, the root cause remains. By root cause, I'm referring to things like oxidative stress. So this is when our antioxidant system has been overwhelmed. Root causes can relate to environmental exposures, sources of inflammation in the body, disruption to the microbiome, nutrient imbalances, exaggerated or inadequate hormonal stress response, or autonomic dysfunction. Unaddressed root causes will usually show up, however, in other ways. That could be other symptoms, a greater vulnerability to other health conditions, accelerated aging, including earlier cognitive decline. Other disadvantages can be side effects from medications. Bothersome symptoms could be things like weight gain, fatigue, anxiety. Other health conditions could be possible, such as metabolic syndrome in someone on long-term antipsychotic medication for schizophrenia. Another disadvantage is that diagnoses can be defining and limiting. They can leave some people to believe that their condition is chronic and incurable, or worse, that their prognosis is poor. Many with chronic complex illness, this would be things like mast cell activation, mold-related illness, Lyme or co-infections, chronic fatigue syndrome, or POTS or postural orthostatic tachycardia, have felt discounted and some even traumatized by mainstream medicine. Without an understanding of root causes, mainstream medicine doesn't have a way to make sense of seemingly unrelated symptoms. Many people have felt they were blamed for creating their symptoms. Some have been told their symptoms come from psychological issues. And I'll point out, I'm not opposed to mainstream medicine. I have a primary care doctor myself that I maintain a treatment relationship with, and who I've relied on much less in the last 16 years since discovering functional medicine. Still, I never know when I may need help, when I may require an immediate intervention, have an injury, or need a referral to a specialist or a surgeon. It is not necessary to choose between mainstream and functional medicine. These approaches do not need to be in conflict. So who finds their way to functional medicine or functional medicine psychiatry? People who want to understand the why they are having their symptoms. They're often deeper divers into information who find satisfaction in figuring things out. I would argue that most are undermethylated, driven, and are good with detail-oriented thinking, which can be both strengths and vulnerabilities. Others who may find their way to functional medicine are those who have not benefited from mainstream approaches. They may have had medication side effects or didn't respond to medication. Or perhaps they responded, but then other symptoms started to show up, and they suspected they were related and wanted a deeper approach and focus on healing. I've had some people reach out who simply felt that the mainstream model didn't make sense to them or fit with their values. Others who make their way are those with chronic complex illness who felt their symptoms were not understood by their doctor or by the multiple specialists they saw. And I'll add that most functional medicine doctors find their way into this type of medicine through their own health journey or that of their child. The first blog I wrote, which I'll link to, I describe how I discovered functional medicine. So what are the benefits of functional medicine? The focus is on the underlying cause of the symptoms. At its best, it also focuses on the whole person. All of these can improve not only the primary symptoms, but secondary symptoms, can prevent other health conditions and slow the aging process and prevent cognitive decline. There is less of a need for medications with functional medicine. The exception here is when treating microbial sources of inflammation. I, for example, will prescribe antifungal medication to address mold. At times, I will use prescription medication to help with stabilizing mast cells. In functional medicine, there's more focus on understanding the why and empowering patients with information. There's simply more hope. People are more engaged in their healing process, and that the interventions often involve, again, education and lifestyle changes. For those with chronic complex illness, they often feel more understood and heard. So finally, what are the risks and disadvantages of functional medicine, and how can we mitigate those? The risks often come when there is not a holistic, whole-person perspective, and when assessments and treatment planning are impractical and not decided in collaboration with the patient. In these cases, functional medicine can, one, involve excessive details, excessive lab data, excessive supplements, excessive attention to dietary interventions, and environmental exposures, and complicated daily routines. An excess focus on lab data and supplements can take the attention off the basics of human health: a sleep routine, movement if not exercise, lowering stress, and improving diet. At times, left unchecked, functional medicine can have people at odds with their body and reinforce thinking that the body is something to fix. The approaches and the research can become addictive. I have spoken to a number of people who have spent a tremendous amount of time researching online while under the influence of high EMF, stress hormones, and breath holding, which we all do when we're on the computer. Just like a slot machine, sometimes there's an answer that leads to important information, but more often the pursuit is becoming another root cause. I can speak to this from personal experience. Functional medicine can also be relatively expensive and sometimes very expensive. Appointments and supplements are often not covered by insurance. Appointments are longer, and the work by the physician is also outside of the appointments. This involves interpreting labs and creating treatment plans, which takes more time than prescribing medication in an office visit. In some cases, functional medicine can lead people to believe that they need to address every single underlying factor to move their body to healing. This is not necessary. Similarly, there are many tools that can be used in functional medicine, but they don't all need to be used. You might notice how the areas that I just mentioned are each aligned with left hemisphere traits: detail orientation, seeing the body as an object, addictive tendencies, and all or none thinking. As patients, I do think that those of us who are undermethylated, fit the CAPS profile, or who have a slow COMT or MAOA seem to be more vulnerable to these risks of deeply diving into detailed information in a way that can become stress-inducing and that can interfere with the healing process. And because most doctors appear to be undermethylated, and most functional medicine doctors are also deep divers, and thus may also fit with the CAPS profile or have a slow COMT or MAOA, they too may be more likely to overcomplicate treatment. And I'm sure there have been times that I have been guilty of this. How can we as doctors help mitigate the risk of functional medicine? We can think big picture. We can aim to be practical. We can avoid excessive testing and set priorities and hone in on the most likely factors for which treatment could have the biggest immediate impact. I have many people reaching out for consultations or treatment who have mold toxicity and are still undergoing a lot of testing and treatment for things like SIBO, leaky gut, food sensitivity, candida, even pandas, Lyme, and co-infections. And in my experience, if they have mold that is not being addressed, they're unlikely to see the benefit from treatment or further testing in these other areas. Doctors can communicate pricing with patients prior to ordering tests. They can seek a collaborative relationship so that they can know what testing and treatment is possible from a cost perspective, but also what's practical from a day-to-day implementation. Doctors can listen well and provide education about root causes and priorities. They can spend time exploring barriers to lifestyle change. If lifestyle changes aren't being addressed, all the supplements in the world aren't going to move someone towards healing. Lastly, have conversations about how functional medicine, as well as excessive online research, can be stressful, especially if it's not balanced by right brain approaches, such as making time to hear oneself, being in nature, being with people, doing something creative. They can also help the patient see that this is just part of the bigger picture of their life. And what can patients do to mitigate the risks that can come with functional medicine? They too can shift into a right brain perspective and regularly seek ways to shift from the details to big picture thinking. And remember that this is about moving the body into balance and supporting healing and not fixing. They can seek ways to be more embodied and at peace in their body. They can return to the basics of health, the stuff that everyone knows and that doesn't require deep dives, but does make a huge difference. Sleep, movement, exercise is tolerated, and a diet that supports healing. They can consider what is getting in the way of their self-care. They can seek out doctors who are practical and don't use excessive testing or supplements, and who don't have everyone going through the same program, one that has to be committed to upfront. And I should say that functional medicine will always have more steps than would be the case with mainstream medicine. But even with that, there is a range of how excessive the testing and the supplements can be. People can seek out doctors who are not authoritarian, but instead listen well, provide understandable education, and who want to know what makes sense for you. If you feel like there's not good explanation for why something's being recommended, be it a test or a supplement, then make sure there's clarity there. You can put research into a box that you go to for a visit, but not to live. Often our answers show up when we're not chasing them down. And above all else, I would say stay connected to your inner wisdom. And as with any of my lists, this list of lists is not complete. So please feel free to add on, agree, disagree, or share your experience. If you'd like to get these podcasts and newsletters in your mailbox each week, please consider subscribing at Courtney Snyder, MD, or on Substack. Until next time, take care. Bye-bye.